Schizophrenia is a disorder characterized by delusions, auditory and visual hallucinations, and disorganized thinking or behavior. As a result of the presence of some or all of these symptoms, the person experiences a disruption in their day-to-day social or work life. The exact causes of schizophrenia still aren't known today, but treatment of the disease has come a long way thanks to researchers and medical providers who have used research and evidence-based practice to improve the lives of people living with schizophrenia. For the first half of the 20th century, schizophrenia was poorly understood, and people with schizophrenia were often feared by the public as monsters. These people were typically locked away in asylums where treatments were often tested on them without consent. Psychiatrists tried all kinds of treatments in an attempt to cure people affected with schizophrenia. However, many treatments were based on little to no evidence, with poor methods used to analyze the results. This was not evidence-based practice at its best. Psychiatrists tried so many weird things: isolating the patients, giving them really cold baths, giving them laxatives, inducing seizures, and of course spinning them around really fast in a chair. Most of these treatments today have been abolished due to a lack of evidence regarding their effectiveness. Many of the treatments are even considered to have been barbaric. However, proper research has shown some techniques, like electroconvulsive therapy, are effective in other disorders. The 1950s saw the development of the first generation, or typical antipsychotics, that showed great value in treating the positive symptoms of schizophrenia. However, research showed that they weren't as effective in treating the negative symptoms, and the side effects were often detrimental. In 1970, the second generation, or atypical antipsychotics, were discovered. They treated both positive and negative side effects of schizophrenia, and they proved to have fewer side effects. This made tolerating the long-term medications much easier on the patients. One atypical medication, called clonazepine, was eventually shown to drastically reduce the amount of white blood cells in the patient, destroying their immune system. As evidence for this was discovered, best practice became to use clonazepine only as a last resort, with close monitoring of the white blood cell counts. Long-term institutionalization also became a thing of the past. Treatment in community has been shown to significantly reduce hospitalizations and improve the independence of patients. Rather than isolating them as we did in the past, evidence has shown that embracing them in the community provides better outcomes. An example of a non-pharmacological treatment that enhances the quality of life for those suffering from schizophrenia is psychoeducation intervention. This intervention involves educating the individuals who are suffering with schizophrenia about the disorder and the symptoms that can occur. Psychoeducational intervention also incorporates caregivers into the program to reduce the stigma surrounding schizophrenia. It also provides an opportunity to educate regarding methods to cope with the symptoms associated with schizophrenia. Evidence suggests that incorporating family into the intervention significantly increases the effectiveness and reduces caregiver burnout and hospitalization. The treatment is also associated with higher levels of social networking among the individuals with the illness, thereby decreasing relapses. A second current intervention for individuals with schizophrenia includes assertive community treatment, or ACT. This approach offers community clinical services to individuals with low patient-to-staff ratios, frequent patient contact, and generally allows for enhanced outreach for individuals in the community. Evidence indicates that ACT has provided patients with an immediate outlet for social services and has enhanced housing stability among these individuals and decreases hospitalizations. In conclusion, untreated schizophrenic illness can ostracize individuals from their communal environment and decrease the level of functioning in employment and social contexts, which causes a decrease in overall quality of life and an increase in mortality rate. Using evidence-based practice, researchers and healthcare providers significantly improve the treatments for individuals with schizophrenia to increase their level of social functioning and therefore integrating them harmoniously into the community.